You've seen it a million times, right? In movies, on TV, maybe even in real life. That clear bag of liquid hanging next to a hospital bed. The IV drip. It's so common, we kind of just look right past it.
But have you ever actually stopped to wonder what's really in that bag? I mean, it looks just like water, but it's one of the most powerful and important tools in modern medicine. So today, let's pull back the curtain and unpack the science behind that deceptively simple-looking bag.
Okay, so to understand what's in the IV bag, we first have to understand ourselves. And here's the big number. The average adult human is about 60% water. Yeah, 60%. That's more than half your body weight. And that water is absolutely essential for basically everything that's keeping you alive right now.
But here's where it gets really cool. That water isn't just, sloshing around in there like a water bottle. About 2/3 of it is actually inside your trillions of cells. We call that the intracellular fluid, or ICF. And the other third? That's on the outside, flowing around in your bloodstream and between all your cells. That's the extracellular fluid, or ECF.
A great way to think about this extracellular fluid is like your body's own internal river system. It's the delivery service bringing all the good stuff like oxygen and nutrients to your cells, and at the same time, it's the garbage truck hauling away all the waste products. So you can see why keeping this river flowing is kind of a big deal.
And that brings us to the most important word of the day, balance. Your body is working around the clock, 24/7, to keep these fluids in a perfect state of equilibrium. The right amount of water, the right mix of salts and minerals. It's this incredibly delicate, constant balancing act.
So what happens when that balance gets totally wrecked? Well, life happens, right? A really bad case of the flu, a scorching fever, major surgery, or severe burns. All of these things can cause you to lose fluids and crucial electrolytes way faster than you could ever hope to drink them. And that's when the whole system starts to go haywire.
And that's where the IV bag makes its grand entrance. It's the tool that doctors use to step in and restore that balance with amazing precision. Believe me, what's inside is so much more than just water. So let's take a quick tour of the main types.
To keep things simple, you can pretty much group IV fluids into 3 main characters. First up, you've got isotonic saline, which I just call the salt water. Then there's 5% dextrose, or the sugar water. And finally, my personal favorite, Ringer's lactate, which is kind of like the everything bagel of IV fluids. It's got a little bit of everything your body needs.
So let's zoom in on the salt water. This is isotonic saline. It's basically a simple saltwater solution that's designed to have the same salt concentration as your blood. Its number one job is to quickly pump up the volume of that extracellular fluid, that internal river system. This makes it an absolute workhorse for things like dehydration or for raising someone's blood pressure if they're in shock.
Next up, the sugar water, or D5W. Now this one is really clever. It's essentially sterile water with a little bit of sugar or glucose mixed in. Your cells immediately gobble up that sugar for a quick burst of energy. And what's left behind? Just pure plain water with no electrolytes that can go straight into your cells to rehydrate them from the inside out. It's like a Trojan horse for hydration. And finally, we get to the everything bagel, Ringer's lactate. You'll often hear this one called the most physiological fluid. That's just a fancy way of saying it's engineered to be a near-perfect copy of your own blood plasma. It has a beautifully balanced mix of electrolytes, sodium, potassium, calcium, the whole gang. This makes it perfect for more complex situations, like replacing the specific fluids lost from severe burns or during a big surgery.
Okay, so you've got salt water, sugar water, and the one with the works. 3 very different tools for 3 very different jobs. Which, of course, leads to the big question. How on earth does a doctor choose the right one? Well, this is where you really see how high the stakes are. Picking the right IV fluid is a critical medical decision. If a patient is in shock with low blood pressure, giving them sugar water is not going to help because it won't stay in the bloodstream to raise their pressure. They need that salt water, and they need it fast. On the flip side, giving Ringer's lactate to someone with liver problems could actually cause serious complications. It's all about matching the perfect solution to the specific problem. Get it right, it's a lifeline. Get it wrong, and you can actually make things worse.
So it's pretty clear, right? An IV bag isn't just about dumping water back into somebody. It's a targeted medical therapy. The type of fluid, the amount, how fast or slow the drip goes, every single part of it is precisely calculated to fix a very specific problem and get that internal balance back on track.
So the next time you see an IV bag, I hope you see it a little differently. Don't just see a bag of liquid.
See a precisely balanced solution, a life-saving prescription that's designed to gently but powerfully restore the body's incredibly delicate equilibrium.
It really makes you wonder, doesn't it? What other amazing marvels of medicine are just like that, hiding right there in plain sight, just waiting for us to ask, what's really going on here? Thanks for digging in with me today.